when I look at what's happening in Alberta, I see it more as a marketing ploy to usher in and to kind of mollify Albertans into thinking, well, if you have enough money, you can go pay for your MRI, your CT scan, your endoscopy. And I think part of the deal that the Premier's swinging, and then if there's something on that scan, then the public system will look after you. Time and time again, if you look at the evidence, and the book has over 460 citations, and the evidence is unambiguous on this, that does not work for the public system. As a matter of fact, when you set up that parallel private-public system, the public system starts to disintegrate even further. So Andrew Longhurst is a researcher out of BC that I follow a lot, and he's done some great work about surgical clinics in Alberta. So he looked at the years 2018 to 2019, pre-pandemic, and 2021 to 2022, and he talks about the rise of these for-profit surgery clinics in Alberta, how they were sort of fast-tracked after the pandemic. And he also then goes on to say, and if you look at Quebec and if you look at Saskatchewan, who are the other two provinces where the for-profit activity is high compared to the rest of the country, if you look at their hip and knee replacement median wait times and their cataract wait times, those three provinces with the most for-profit activity have some of the worst wait times. And there's a multitude of reasons for that. Number one, they're staff splitting. So we know there are so many human resources in the system. You and I both know about the nursing shortage across the country. We hear almost weekly about what the physicians are dealing with. And so if you are working in a public hospital down the street and you have 100 nurses and 50 doctors, and a private clinic opens up across the street and they pull half of the docs and half of the nurses because the hours are better, because the clinics are not open on the weekends, they don't work holidays, they're 9 to 5, Monday to Friday, so that entices people to move. In some instances, the salaries are better. Then you've just depleted the public system. You've not only left the public system depleted, but these private clinics seem to cherry pick what surgeries they're going to do. So
Right.
they have a criteria. They take the most stable, the youngest, people
Right.
who are low risk. So now you have a situation where the public system has all the chronic high risk surgeries and a depletion of staff. Well, we both know what that means, Amy. Longer wait times.